Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs.
Welcome, everyone. My name's Lauren. I'm the program director here with Cancer Support Community Atlanta. Today, we have Jen with Empowering Intimacy. Jen will be presenting on ostomy, intimacy, and sexual wellness. So thank you, Jen, for joining us, and I'm turning it over to you.
All right. Thank you, Lauren, and thanks for having us again. Like she said, my name is Jen. I'm the owner of Empowering Intimacy. And today we're going to talk about ostomies and intimacy and how this can affect our sexual function. So just a few minor things to start. Empowering Intimacy is an advocacy organization, and we focus solely on educating and empowering people and medical professionals on sexual health, sexual wellness, intimacy, body image, sexual dysfunction, and everything that falls under that umbrella. We work very hard to support cancer patients and their partners all the way through survivorship until people just don't need us anymore. And we also kind of stand in the middle between patients and medical professionals to kind of bridge the gap. So this type of information can be talked about and can be handed out readily. So people aren't left wondering when they're dealing with these types of situations. I am a sexual wellness expert educator. I've been doing this for over 20 years now. And so people like myself, we show up to help people learn about their bodies, to better understand how things can work when they aren't necessarily working normally. And we just kind of stand in when people need us, how they need us. So it's how we interact with people is different for every situation that people are facing. We also work with medical organizations, much like this one, to bring these types of resources and presentations so that people can just learn, can hear the things that we're saying, can read the things that are on our slides, and kind of have eye-opening moments to the things that they might be missing or might be kind of afraid or hesitant to bring up to their medical team. As you can see by this slide, I am an ostomate. I have an ileostomy that is a permanent part of my life. So I absolutely understand the things that people are going through when it comes to ostomy living. You can find lots of things on the Empowering Intimacy website, lots of free things, tons of resources. We have recorded educational sessions, empowerment sessions that are done between myself and medical professionals from all different areas, including oncology, including WCON nurses. Those are the people who help us take care of our ostomies and stomas. Plus a lot of other different personalized services, lots of information on the holistic devices that can help us restore some lost sexual function, and things like personal assessments or just some general information if you were to email in. So all sorts of things there should you ever need. And I always say I'm always an email away if people have questions or just need an ear to listen to vent about ostomies and how hard it can be to get through each day. Part one, ostomy basics and defining intimacy. So I do this presentation in person as well. So this slide here, the Let's Break the Ice, a lot of people name their ostomies, their stomas, their ostomy bag. So we always kind of go through some silly names. People do. Some people like to name them, especially if they are going to be a permanent part of your life, kind of just an extra thing that you have there to joke about or be silly. Some people don't like to name them because they don't like the thought of them possibly being permanent, or they feel like that puts too much permanence on a temporary ostomy. Either way is totally fine. It's a personal choice. So the first is the colostomy. Colostomy is a surgically created opening of the colon or the large intestine, and it can happen anywhere around the large intestine. There's different sections of our colon and large intestine, and those can be placed anywhere in there. Typically with a colostomy, the portion of the colon that is beyond the ostomy, the stoma, is removed and the rectum is closed. And typically colostomies are more of a permanent nature. The next would be the ileostomy. The ileostomy is the surgically created opening that occurs at the lowest part of our small intestine. So where our small intestine connects to our large intestine or the ileum. And this then, ileostomies can be temporary or they can be permanent. It just depends on the situation. For some people who have permanent ileostomies, they do have their colon removed and their rectum sealed. That's also called a Barbie butt or a Ken butt. Um, that is not always the case. Some people with permanent ostomies do just keep their colon in there, although it is not being used or useful, and it just kind of hangs out in there. Another type of ostomy is the urostomy. A urostomy is kind of a general term for any of the many types of urostomy surgeries that help to drain the bladder of urine when the bladder is diseased or has been damaged or isn't working properly to drain in a natural, normal way. There's many different ways that they do urostomies using different parts of intestines to help create this output stoma. So again, this just depends on the situation of the individual. Mm. Another type of an ostomy is called a J pouch. So a J pouch is created out of your small intestines typically, and it makes kind of a reservoir or a pouch that sits in the abdomen that collects the stool. And then the pouch is drained regularly. The J pouch surgeries are not typically done first. They're kind of a second or third ditch effort, so to speak, when an ileostomy might not be possible for some odd reason. And J pouch surgeries require a few consecutive surgeries to get things straightened out and settled, whereas an ileostomy surgery typically requires just one surgery. Um, So there are many different types of ostomies that are out there. There are some more that I did not list here. These are just kind of the most common that we hear people discuss. So we always like to touch on those here. And then, of course, all of those ostomies, whatever type of ostomy you have, even those people who have feeding tubes end up with a stoma. And the stoma is the opening that is created in that surgical procedure using an intestine. So the red dot that you see there, it should always be dark pink or red, is the stoma. And typically, stoma is covered by the ostomy pouch or the ostomy bag where stool and urine is collected. And so that's what a stoma looks like. They can come in all shapes and sizes. They're not always circular. Some are oval, some have kind of no shape. It just kind of depends on what your intestines are feeling like in the moment sometimes and how well your surgeon does with the installation of that, so to speak. Stomal care and issues hinder intimacy and sexuality. So, your stoma is your intestines on the outside of your body, and intestines are very sensitive. As you know, if you have an ostomy, if you bump it when you're changing your bag or as you're wiping it off when you're changing your bag, it can start to bleed gently, very easily. So it's something that we kind of have to pay extra attention to and take extra precaution with. And sometimes bag change days, I don't know if any of you experience this, but sometimes they can be kind of stressful. Trying to get your output managed so things are slow so that you can have a calm bag change. It can be kind of overwhelming. So that and these things I'm going to say next, they can really hinder intimacy and sexuality, how you're feeling, if you want to be intimate or not, and things like that. So the inability to bend your body in certain ways to the positioning that you were used to for those intimate moments or sexual times, you can't do that anymore. So that can really hinder things for you. It can make you feel kind of bad and disconnect from yourself. You might have a noticeable difference of how your partner is touching you and interacting with your body. There can be skin irritation that can occur from constantly wearing an ostomy bag, especially right around the stoma. And that can feel very irritated and sore sometimes. The time that it takes to get used to having your intestines protruding from your abdomen, that can be kind of a mental strain and kind of play with the mental health side of things. The stomal pain, swelling, and discomfort can really hinder intimate time because it can create a worry that you're not sure what's happening, if you're going to have trouble with the stoma, why it might be swelling or protruding more, and that can kind of wipe out intimate time. The process of the bag change itself, the preparation that it takes to get ready for that bag change, the mental aspects of just having a stoma and knowing that that's something that you're going to be dealing with. And then those life changes that have to occur because you have a stoma, how you have to travel with extra supplies and take time out to stop at extra bathrooms to empty more frequently or change your bag if you've had a leak. All of those things can really hinder how we connect with others, especially in intimate ways. Some of the common stomal and ostomy problems and issues. Of course, there's a retracting stoma. So that's when the stoma that's sticking out of the abdomen kind of pulls back into the abdomen. Intestines are always moving and always functioning to push those liquids that we're drinking and the foods that we're eating through. So if an ostomate or a person who has an ostomy hasn't drank enough liquids, hasn't eaten yet for the day, sometimes the stoma can start to kind of retract into the body. And sometimes from the pulling of those tissues retracting in, it can be very painful. A retracted stoma can also hinder how our bag, the ostomy bag, connects to our bodies. There's also something called a prolapsed stoma. And this means that the stoma has prolapsed and pushed outward more. So it comes out of the body more, often making the stoma much bigger because it's more of your intestine that has pushed outwards. In some cases, people just simply lay on their backs and kind of gently massage the abdomen and it kind of falls back in place. In other cases, people use sugar to put on the ostomy to help retract some of that moisture. Sugar pulls the moisture out and thusly helps that intestine kind of calm down and fall back into place. And in other cases where the prolapse is very large, surgery might be the option. Another issue is painful skin or skin issues around the stomal skin. So that is going to be right where the stoma connects to the abdomen skin. It's very tricky sometimes to get your sizing correct of your flange of the ostomy bags. And so sometimes if we don't cut that opening right and we have some skin peeking through, output can really damage our skin. The acidity from stomach bile, from the fecal output itself, all of that is very skin irritant. And so it can take time to work through those stomal wounds if you have those. And it's super important that you always make your wound care nurse or your ostomy nurse aware if you have these types of wounds and pay very close attention to those. Another issue is the leaking appliance, wafer, or bag. These unpredictable happenings can derail everything. Your day plans, your intimate plans, just about everything when it happens, because it's really frustrating. Especially when you're new to having an ostomy. It can feel really overwhelming. And the last here is the abdominal pain or the pulling sensation. So the stoma itself doesn't have nerves. So the stoma itself doesn't really feel pain. However, the connection where it connects to that abdominal skin, and then all of the tissues behind it that have kind of been moved and stitched into place, all of those can still pull and move and twist. And so that's where some of the abdominal pain or cramping can come in if you start to feel it. This question here, why is understanding intimacy so vital for us to be able to embrace intimacy in our ostomy lives? Or for someone who has an ostomy. So this is important because understanding the intimacy and self-connection can help us with our whole body healing and our overall health. Understanding how intimacy can help us to work through or get over some of the aspects of physical intimacy can be very important. Embracing intimacy allows more level mental headspace. Because again, when we are getting the things that we need and we feel whole and fulfilled, things level out more. And embracing your partner's intimacy needs helps to strengthen your bonds for a more nurturing, honest relationship. So then we're going to define intimacy, because again, intimacy is a huge part of human nature and human need. We were all made to need different types of intimacy, to desire it, to crave it, to want it. And it doesn't just mean physical intimacy, of course. I do a lot of these presentations, and in person, we always ask, what does intimacy mean to you? In fact, you'll see that at the bottom of the slide, there's bold questions. And I always I always invite people to write those down and journal them later or answer those questions for yourself and with your partner later. It's a good jumping point to kind of restart in a relationship to level things out again. The dictionary defines intimacy as the innermost thoughts and feelings that we have, our most personal, private parts of ourselves that we are then sharing with someone else. And for people, it's different for everyone. Some people hear the word intimacy and they immediately think of sex or sex acts. Someone else might hear the word intimacy and they think of the quiet time they have with their partner, cuddling on the couch watching a movie together. So it truly is really up to each of us how we feel and deal with intimacy. Some of the most common types of intimacy that we hear about in our everyday lives, that we might hear discussed or see happening on our favorite TV shows, are these types here that are listed at the top 5. So, of course, we have physical intimacy, which does include sexual acts and intercourse, but it's not limited to that. Again, physical intimacy can be as simple as holding hands with your partner or being in close contact with someone as you're talking to them, doing things together, close in the cooking dinner together. It's even considered an intimate act. Any type of skin to skin touch, not necessarily naked skin, just shoulder to shoulder. It can be super basic like that. All of those things count as physical intimacy. Experiential intimacy is a type of intimacy that's shared with doing things together, with built shared experiences. So you're creating those memories, you're meeting those goals together, you're experiencing things together. That can help people stay bonded together. Spiritual intimacy is often thought of like a church kind of vibe, like people who share the same spiritual thoughts. And that's true, it can be, but it also encompasses our personal beliefs, our core values, and our morals. And so when we're sharing those with another, we're creating that type of shared intimacy. Emotional intimacy, that's kind of a tricky one. Emotional intimacy is built in relationships, and not just intimate relationships, but friendships, family relationships, coworker relationships. And it's those things that we share as we take time to be present with one another. When we listen to people, we focus on what they're saying. We stay present in moments where we're interacting with others, noticing things that people need, acting on those things. That helps to build emotional intimacy. Intellectual intimacy is the intimacy in situations you build when you're sharing your brain, sharing your smarts with someone else. You're having those important conversations about those deep topics, or even just silly topics that you found on the internet, that you're talking about between yourselves. That builds that intellectual bond. And on top of those 5 types of intimacy, there's also over a dozen more. And you don't hear about those as much, because they're really focused. And some of them are at the bottom of the slide there. Work intimacy, the type of relationships you build with your coworkers. Sometimes you hear people joke they have a work wife or a work husband. That's often work intimacy that is kind of created there. Creative intimacy, how we take the time to craft things or build things or make things together. Chaos and crisis intimacy, how we handle tough situations, tough medical situations, and work through them together. And then communication intimacy. That one's probably my favorite. Communication intimacy is how we speak to each other, how we connect to each other, how we share our thoughts, needs, wants with each other. Doing that helps not only to keep relationships strong and bonded, but it also helps us to feel more whole and heard. And so we talked about all those types of intimacy. And the thing to remember is that it's not just about the partnerships and relationships that we have, it's also about our relationship with ourselves. Because that's often the first thing that takes a hit when we face any type of medical stress or chaos. We tend to disconnect from ourselves. We put our extra needs kind of on the back burner in hopes that we can get back to them someday. And so often when we disconnect from ourselves, we stop loving ourselves as much as we should. We stop doing those extra things for ourselves. We become critical of ourselves. We stop giving ourselves enough time to complete projects. We take the patience away that we have with ourselves. And that can really create that self-disconnect. So self-love is a vital part of who we are as human beings and how we can motivate ourselves. And so that's why we're talking about this, is because when we have major medical procedures and we have to live with something like an ostomy, whether it be temporary or a permanent basis, we have to really try to stay connected to ourselves to keep ourselves moving forward. Because it can be really easy to just let that disconnect happen and just let things go. But with our self-love, it allows us to take care of ourselves. It allows us to lower our stress levels, to heal our bodies faster, and to stay on that life path we've made for ourselves, and to keep hold of those goals for the future. And of course, intimacy in relationships is vital and important as well. We wouldn't have relationships if we didn't have these different types of bonds with the people that we love and care for. So all of our relationships that we have different types of intimacy in them. And for our romantic relationships or our partnerships or marriages, really taking the time to pay attention to these different types of intimacy is vital, because when we can't do one of them. Say we can't be physically intimate because we've just had surgery or we're just working through our body issues. We can still practice all of those other types of intimacy to kind of help keep those bonds strong and flowing forward. So it's always something to pay attention to. Communication, when and how to approach intimacy and sex. This is a question that we get a lot. It gets brought up a lot at many of the presentations we do. So after surgery and these types of body changes occur, it can be terrifying to know when or how to revisit the topics of intimacy or sex. A lot of times people just want to know, how can I just get back in there and just go to it? And for some people, that works out very well. They can just jump right back into how things were or their normal routines with very little trouble. For other people, it's a bit more hesitant. It's a bit slower, and we often say that our internal fears kind of jump out. We're afraid that we might not be able to perform. We're afraid that we're going to be judged. We're afraid that our partner isn't going to want to deal with our bodies because we have these devices or differences that we didn't have before, which leads to a fear of rejection. And all these things can really impact our mental and emotional psyches, so to speak, and it can really take a while to get back on track. So this is why when you think that you're ready to kind of get back into the intimate swing, even if it's just, cuddling on the couch or doing very basic things, you got to remember that you're going to need to communicate that to your partner so that you're both on the same page, so that everybody fully understands what everyone else needs and wants. Initiating sex acts. So again, like I said, for some people, you can just jump right back into all the normal things that they were doing, including sexual intercourse. For others, that's just not possible. So we always advise to start at the basic, to go back to that base level and start with cuddling, start with holding hands, start with gentle kisses. Um, all of those things are not only beneficial for your relationship and your own personal mental health, but it can help you to then just keep that train rolling in that comfort zone to then get back to the places of sexual intimacy and sexual acts and connection that you had before. So not all people with their ostomy surgery, some people have extra things happen or emergent situations occur during surgery. So they might end up with a urostomy and an ileostomy, or need a future surgery to correct something else that happened. So sometimes people can't jump right back into the sack, so to speak. They have to give their bodies time to heal. They have to wait for their surgeon to clear them so that everything is safe. But there are some people who like to, push the rules a little bit and jump back in little prematurely, so to speak. And we just have to make sure that, especially with ostomy surgeries, we're being very careful with our abdomen area and our bodies. Fresh after surgery, not all things are healed externally or internally. So we have to pay attention to those things as to not cause our bodies more trouble. Mm. Part two is going to cover body image, mental health, all with ostomies, of course. So this first slide here covers some of the common causes of an ostomy. Some are common and some are a little bit more on the rare side. So birth defects, bowel obstruction, of course, cancers, diverticular disease, inflammatory bowel diseases, GI motility issues, endometriosis, Crohn's disease, ulcerative colitis, urinary or stool incontinence, and of course, they can also happen after accidents or injuries. There are many other reasons that people end up with an ostomy that are not on this list. Super common things, some even more rare than that are listed here. It can happen to anyone at any time. And it can also happen temporarily so that the body can heal from another type of surgery or another type of injury that was occurred. So body image is kind of another vital part of our human makeup. Body image is how we feel about ourselves, how we think about ourselves, how we think that others are seeing us. And body image can be a very positive or a very negative thing. A lot of times when we've gone through stressful situations, our body image, especially with an ostomy, because our body is changed physically, visibly, it can be very hard to deal with. And our body image, our mental health in that category takes a direct hit. And one thing I always like to remind on this slide here, it says the truth is the perfect body does not exist. And that's something that I find myself saying a lot to myself and a lot to others because it's very true. And when it comes to body image and mental health headspace, we have to work very hard to keep our thoughts as positive as possible. So, and it's difficult, especially when we're first dealing with these ostomy changes, to kind of look down and see what we have to deal with and tell ourselves, okay, this is positive. This ostomy just saved my life. Because that's the truth for many people. That's what ostomies do. They save lives. Do they hinder our lives as well? Absolutely. But I can tell you that without my ostomy, I would probably not be here today. So, for a lot of people, the emotional and psychological toll this takes on us um, might even need the guidance and help of a mental health professional, counselor, a therapist, even a social worker that's started working in the cancer sector. Someone like that can really help you kind of stay on track and on the path to positive mental headspace. One aspect of body image issues that can turn kind of dangerous can be body dysmorphia disorder or BDD. This is a very common type of mental health issue that very, very, very many humans deal with. Not just those who are facing like a medical crisis or ostomy living, but just people just going through regular life as well. So BDD, it occurs when a person kind of can't stop thinking about their body flaws. So these body flaws that they are so hyper focused on might not even be able to be seen by another person. These are just those personal thoughts that we have about areas of our body that we wish we could change or wish weren't there. And it can spiral kind of out of control. It can happen at any age for any reason. So some of the symptoms, constantly looking at your reflection in mirrors or avoiding mirrors altogether, skin picking or attempting to make skin smooth, focusing on comparing yourself to other people and their bodies, spiraling and worrying about specific body areas, including the face, over the top methods of covering flaws. So wearing excessive makeup, really baggy clothing, specific hairstyles might hide parts of the face, things like that. BDD is often linked to other mental health disorders as well, depression, self-harm, suicidal ideation, suicidal thoughts, self-harm. And this disorder can affect every aspect of a person's everyday life, and it can become very daunting. So if you or someone you know starts to exhibit these types of signs for this issue, it is recommended that they seek out medical professional support in the way of their MD doctor or again, a mental health professional. Mental health with an ostomy. So we as humans tend to cycle through grief and mental health issues kind of in the same ways, really. It just depends on how we move through these cycles as an individual. So it's important to realize that we are always moving through cycles with something. We're working through thoughts that we're having, we're working through the thoughts that come with our medical treatment, how we're living our daily lives. And the important thing to know is that the cycles are always going to cycle. So as long as we can recognize where we are in these cycles and be honest with ourselves about that, you can kind of keep working through anything. So the first phase is shock or panic. So this often occurs right after surgery, when you're kind of getting all the information and you're learning how to deal with your ostomy and you're learning the changes that your life is going to, affect. And your doctors are just kind of spewing information at you constantly. It can be very overwhelming. So that overwhelm could last for days, weeks, or months, where you kind of fall back into this anxiety and panic that this is your life. The second cycle, defense, retreat, denial. Um, this section can last for days, weeks, or months as well. And this is kind of where we start to deny or minimize what we're going through. Oh, it's no big deal. I'm just going to keep on keeping on. Try not to change anything and just keep moving. Where you kind of hide the parts that are really hindering your life and the complications. Um, Trying to tell yourself that you can avoid all these things, even though that you know that you can't. Kind of that wishful thinking. The third is acknowledgement. This is kind of as we move through one and two, we're realizing that this is our reality. And we have to kind of give up the things that were prior to our ostomy surgery, the things we could do solidly, before, we're not going to be able to do now. So that realization and acceptance, um, kind of moving through that. And that can lead to some temporary issues, mental health setbacks like depression, kind of apathy for things, realizing that this is life and kind of adjusting to it. And then we move on again. The fourth, adaptation and resolution. So during this time frame, the grief that we have, the anger that we might have built up of these changes that we couldn't control, kind of starts to lessen, and we are learning how to manage, and we are learning how to deal with our everyday lives. This phase can take days, months, weeks, or even years. And then the great thing is that we'll just cycle back through all these steps at various points as we're going through things in our treatment. For those people who have a temporary ostomy, who then go back into surgery to have the reversal done, you'll go through all of these phases again, kind of relearning to live with a regularly functioning colon. So it's just kind of something that we as humans just kind of constantly cycle through. There's also steps like this that we work through when we have grief in our lives, for things as well. The common factors that hinder or exacerbate these types of mental health issues for ostomates and our families, some of them are the loss of insurance or specialized medical care, disconnect from ourselves and our bodies, inability to comfortably discuss or talk about the ostomy, confusion or worry about disclosure. And disclosure is when we are comfortable telling others, telling strangers, telling our boss at work that we have an ostomy. That's disclosure. Employment issues, losing a job, not being able to return to work, finding a new job with a disability. Sexual dysfunction issues like loss of libido or loss of sexual function. Fear of intimacy, fear of dating or relationships. Dietary changes and needs, that's a big one for ostomy life. And hydration changes and needs, that's also a big one for ostomy life. Improving body image while living with an ostomy. So improving body image takes a lot of work, regardless of the situation that you're in. But it is possible to improve your overall body image if you're willing to put in the effort and time and give yourself the things that you're so readily giving to others. So finding comfort with your clothing style. Having an ostomy and having a stoma can be tricky with clothing. Where ostomies fall on the abdomen is often right where our pants go. So finding the right type of pants that fit, that don't push on the stoma or hinder the bag, can be really tricky and kind of overwhelming. Being patient with yourself and all of the changes that come. Focus on your strengths and the abilities that you still have. And don't wait to get professional help or support if you think that you need it. Find positivity where you can. Reframe your thoughts about your stoma. Be active when you can. Keep up with nutrition and hydration directions. Embrace your uniqueness. Because, not everybody is going to get to be cool and have a stoma. Understand how this ostomy is helping your life and your situation. Empower yourself with education and information. Try new things. My favorite, give yourself grace. Part 3 is relationships and intimacy with an ostomy. Friendships and relationships. So adjusting to having an ostomy comes with mental changes, life changes, relationship changes, comes with all of the changes. And these changes could be kind of just more personal for you as you work through things where you're just not connecting with as many people or like you did before. And it could be temporary or it could be a permanent change that you've had within yourself. Or it could be the people that are around you, they're just not sure what to do in this situation. They might not be totally comfortable in what they should be doing or how to support you. And they might just feel really bad and just not have the positivity that you need for that support. So, important things to remember: to find like minded ostomates to connect with, to join local or online support groups. You can also join online private communities and support groups. So there's a difference between public groups and private groups. So make sure you pay attention to that because that's important for some people. Understanding that some people might not be able to handle this type of stress, medical stress specifically, or medical chaos that you have in your life. Find supportive, positive people to be in your life. Don't take other people's distance personally, even though that can be so very hard. I know that was one of the things that I struggled with the most after my surgeries and kind of coming back to life and still struggle with now. Be prepared for relationships to change and be patient enough to give them time to level out. That's also a huge one that I drive into my own brain daily as well. Relationship connection and disconnect. There are factors in every relationship that you have that helps to keep a relationship strong and bonded. When those types of things change, so does the relationship. Some of those things are trust, support, empathy, communication. The list kind of goes on and on. And so, as you're working through the challenges in your life, adjusting to an ostomy, sometimes some of those things can ebb and flow a little more or less than usual. And it's important that we don't stop to dwell on those for too long, that we acknowledge them, and then we do our best to move forward working on those things. So, for us as ostomates adjusting to this life, we have to make sure that we are paying close attention to ourselves and taking action when we need. So when we notice that we're having mental health issues or body image issues or intimacy issues or dysfunction issues, that we speak up and we seek help in the right places so that we can level back out again. Communication issues, also a huge point. Ostomy issues, especially, and medical issues to stay on top of so we don't have spiraling issues. And as all of those things help us to maintain our relationships as we work through these difficult situations. This one's for those people who might have a partner or be the support person for an ostomate. I hear from a lot of people that their person has an ostomy and they just aren't ever really sure what they should be doing. So I always advise people that the first things that should be on the top of your list are to educate yourself as much as possible about your person's condition, what led up to this ostomy, and all about ostomies that you can find, and to really work on being patient with your person. Those two things alone show that you are putting forth effort, that you are dedicated to your person, and that you truly love and care for them. Other ways to support your ostomate would be to learn to support them before they have ostomy surgery. educate yourself on ostomies, provide the support that your person needs. So, what that means is that sometimes we think we're doing right by our person when it turns out that what we are doing is nothing of what our person really truly needs. So, that's why communicating about these things ahead of time can be really beneficial so that you can both be on the same page, especially then when it comes to caregiving after ostomy surgery. If you are helping care for your ostomate, learn about stomas and common stoma issues. Be flexible. Do not push intimacy or sexual situations without prior communication. Put your person's needs above your own sometimes. Of course, not all the time, but sometimes. Do not shy away from talking about output or poop, because let me tell you, once you have an ostomy, it somehow just becomes the topic of conversation all the time. Just ask my kids. And the last, do not expect your ostomate to be your educational source. And that's an important one. So often living an ostomy life, it can be exhausting repeating yourself over and over or saying the same things that you need or trying to teach people about why this is happening or why you can't do something. So it is so nice to hear, someone come up to you and say, "Hey, how are you doing? Things are great. Hey, I took some time and I read some articles about your situation, XXY, and I understand better now." And like having that conversation is so positive and so helpful and amazing that it can really lift your mood and show you which people in your life are really truly there for you. Accepting changes that hinder intimacy and sexual function. So these are the common changes for men and women that we've heard from that really hinder how they're feeling intimately or what they can do intimately or sexually with function. So, common issues reported by men: abdominal pain, erectile dysfunction, ejaculation dysfunction, retrograde ejaculation, anorgasmia or orgasm issues, loss of libido and or desire, and incontinence. And that can be incontinence of the bladder, the bowel, or whichever you don't have the ostomy for. Common issues reported by women also have incontinence of whichever we don't have the ostomy for, loss of libido and desire, pain during penetration or any type of vaginal exam, insertion pain, anorgasmia or orgasm issues, vaginal atrophy or dryness, and abdominal pain. So you can see that both lists are kind of similar, and that is because the male and female bodies makeup were very similar. And so we do experience a lot of the same types of sexual dysfunction issues and intimacy issues. And so this is just, again, not a full list. There are many more things that could be added. So these are, again, just the most common. Part 4 is sex and sexual dysfunction with an ostomy. Easing into sexual acts with an ostomy. Which So again, we've talked a lot about intimacy, we've talked some about sexual function. And so it's important to remember during this section that we can be intimate and we can experience sexual pleasure without ever being naked, without ever having sexual intercourse. There are lots and lots of different paths to pleasure, I like to say, lots of different methods that can be learned. And for a lot of people who end up having an ostomy, they'll be able to just jump right back into their normal routine and continue with their sex acts and all of the things they were doing before with their partner with little to no issue. And so, with an ostomy and getting back into sexual acts, one of the big things that I hear from a lot of people and experience myself is really learning your output cycles. This can be extremely helpful when you are preparing to get back into the intimacy and sexual acts realm, so to speak, because you're going to feel more confident with your body. So, for most people who have a typically normal functioning GI system, when you eat, within a few hours after, you will be outputting what you've eaten. For other people who have GI disease or motility disorders, it's a little harder to predict output because sometimes our bodies just decide to not output for days. So it can be really tricky then. But getting to know your body and how quickly you turn over that food and those liquids that you're drinking can help with intimate situations. There are also different types of devices, there's methods, there's different positioning tools that can all help to kind of make you feel more confident, make you feel sexy, even, and ready to take on these intimate and sexual acts again. And for some people, as they get back into this and they start being intimate again, whether it be with themselves and exploring their bodies again after surgery and the changes, or with their partner, they might notice that things don't feel the same way. They might not be getting pleasure in the same way or the same areas that they did before. And that is often because of stress to the body, surgical intervention, and mental health. So these things we can work through. And again, this is then why it's important to know our bodies fully so that when something might not feel right or we don't like it, we can just kind of adjust our scales a little bit and we can continue on to find that pleasure. So this specialized clothing. Hear from a lot of people that they have some body image issues with their abdomen because the stoma and the ostomy bag are there. They just don't feel as sexy or they don't feel as attractive because it's just hanging there, just dangling in the way. So there are some lines of clothing for men and women, actual clothing and actual lingerie that can be worn during intimate acts or sexual acts to not only support the abdomen and the ostomy bag, but also provide a cover up and kind of keeps everything in one place tightly. So you don't have to worry that the bag's going to be like flopping around or getting in the way of anything. So we just put a bunch of different websites here that have some really high quality ostomy clothing. And then Amazon also has a huge variety of different types of ostomy clothing, some from these companies here that are listed on this slide, and then some from other places. A lot of places in like the UK and places like that also have really high quality ostomy clothing and support belts. So just to note that. I talked a little bit about positioning. I hear from a lot of people that they are ready to get back into the sack, they're ready to be with their partner intimately again, but they just can't find a comfortable place to do it. They can't find a comfortable position that doesn't feel like it's impacting their stoma or causing their partner to have to contort or do crazy things. So we always suggest different types of positioners. There are a couple companies out there that do nothing but make positioners for different sexual acts, for sleeping differently in beds. All sorts of different positioners exist out there. So if you're a person that prefers sexual act on your back, there's those. If you're a person that typically would lay on your stomach, there are also positioners for there that giant pillows that have kind of the center cut out. So your ostomy would kind of fit into that open hole, thusly putting no pressure on it. So there's lots of different things that can be very supported for people with disabilities or different types of handicap that might need this type of support. So it does exist. The next couple slides are going to discuss things that you should know and that you should not worry about when it comes to certain types of sex acts. So it kind of goes by category. So the first one is foreplay. Of course, foreplay is the sensual and intimate things we do before big sexual acts are taking place. So, of course, foreplay always requires communication because we shouldn't be doing things to our partners or with our partners if we don't even know what they like or want or dislike. So, always requires communication to know that. And then not to worry about and to know. So, one of the things that comes up a lot is that people are unsure where they should or can touch. This is kind of a partner issue because when we're massaging each other, or maybe we're making out, or we're hugging, where do I put my hands if you have an ostomy? Can I touch it? Will it hurt you if I accidentally bump it? So, all of these types of things can be discussed prior to starting any type of foreplay. And then there's some silly questions here, things to not worry about. Does my bag smell? I promise that if you had a leak, you would know, you would smell it. And then the other question, what is my partner thinking? I get that one a lot from people who say, we're all heated and I take my shirt off and then I catch my partner kind of looking at my ostomy, trying to not focus on it, trying to stay in the moment, but we're both focused on it now. So what are we thinking? So all these questions and these types of things you can talk about with your partner openly. Sometimes when we can approach subjects that make us kind of fearful or make us embarrassed, if we can kind of approach them with a half smile and kind of a mood like that and approach it with that smile on our face, it can kind of calm those nerves and tensions. Oral sex for both men or for women, whoever has the ostomy. Um, Bag locations can kind of be problematic sometimes for some people, and they worry that without that belt that's supporting their bag or those lingerie or clothing items that can kind of keep it up and out of the way, that the bag might dangle downward and fall into the area where their partner might be trying to pleasure them, which that can be kind of detrimental and mood ending. So again, those things like support belts and those types of clothing can help with that. With oral sex and practicing those, this can help. These types of sex acts can help you to learn to relax your body and mind before the bigger acts of connection and sex come into play. A lot of times, the questions and things that we've heard from couples, am I outputting while this act is occurring? For a lot of ostomates, even when we are presently in a sexual situation, our mind is still constantly thinking about the ostomy. And if it's outputting, if my bag is filling up too quickly, do I need to take a bathroom break? All of those types of things will go through your head, and that's okay. Don't have to worry about it. Sexual devices. So these would be like vibrators or, different things like that that you could kind of bring into your routine. The devices can be great to help you to relearn your body again after surgical intervention, because again, so often when our bodies have been hindered, things change how they feel, things we like. And these types of devices can also help to restore some lost genital function and feeling. So if we've had cancer treatment in the area of our genitals or pelvic region, if we've had surgical intervention, anything like that, using things like vibrators or penis pumps, all of those things can help our bodies to kind of remember what we were doing and how they're supposed to work. Um, do these types of devices bring back all function? No. But again, for many people, we don't always need full function to feel that pleasure and get that orgasmic relief. And then the question there, will this device hurt my body? Now, sexual devices like vibrators and penis pumps, and some of the things you'll see pictures of here in just a second, they're not designed to hurt. There's almost no way that some of them can. So that's, again, something that you just don't need to worry about. Masturbation. A lot of people talk about masturbation, and sometimes in not such a positive light. So, masturbation is giving ourselves sexual pleasure, essentially, whether it be with our hands, devices, your partner, all sorts of things can play in here. Masturbation is body positive. It doesn't hurt your body. It can help you to get to know your body again. It promotes mental calm and well being. It helps to restore muscle memory and lost function in the genital region and other muscles around your body. It not only improves your self connection, but it also improves your overall mental headspace and that self love that you're working on. The judgment statement, I should not be touching myself. We hear this a lot. And of course, this is an individual personal decision. Many people were raised in a time, a culture, a time frame in religious areas where they were taught to not discuss these types of topics. They were taught to not touch their body in any way. And we are here to simply say we were given these bodies to use up until we pass away. So if pleasure is something that you are seeking with your own body, there is really nothing wrong with it. Sexual intercourse brings positional challenges like we discussed. So falling back on some type of positioner, or if you didn't want a positioner, you could also use a whole lot of pillows and blankets to kind of achieve the different positioning that you're looking for. Sexual dysfunction often becomes an issue, and there are lots of ways to work through sexual dysfunction issues for men and women alike that don't involve medications and don't involve more surgeries. Both men and women often experience pain with sex for various reasons. This is also something that we can look to work through and kind of get our bodies back on board again. And then some of the questions that come up when sexual intercourse is at play. Am I hurting my partner? This is one that many partners have said out loud as we've done these ostomy presentations and sessions with people, is they're so happy to be connecting with their partner in a sexual way again, but they say that they can't stop thinking that while they are performing this act, they are hurting their partner, even if their partner is not hurting and they are very pleased and happy. It's still a worry that happens in the partner's mind. And then the other question there, is my partner thinking only about my ostomy? And I think, again, like I mentioned, that that's more of an ostomate thing, the person that has the ostomy constantly thinking about it as simple steps to prepare for intimacy and sex acts. So one thing that I hear a lot is that spontaneity just seems to be gone. Because typically for a person with an ostomy, before we're going to be intimate or sexual with someone, we need to make sure that our bag is ready, that our bodies are ready. So this means having bathroom time or time to freshen up before. But one important thing to remember is that most people, whether they have an ostomy or not, take time to freshen up in the bathroom before they're participating in intimate or sexual acts. So it's really not that different. But some things to remember that can really make it easier to prepare is to empty your bag or change your bag prior to beginning any acts. If you wear a clear bag, consider using a pouch cover or an ostomy garment or lingerie to cover it up, especially if the sight of the output or fecal matter is problematic or not wanted. A shower or bath can make anyone feel clean and fresh. Avoiding large meals leading up to any intimate moments or planned sexual acts can be very helpful. Some ostomates even use things like Imodium, over the counter Imodium, which slows down fecal output prior to preparation for any intimate or sexual acts. We always say before we take any type of any medication, we would want to check in with our doctor to make sure that that is okay before we do that. Communicating with your partner and letting them know what you may or not be comfortable doing prior to doing it. And knowing that gas happens. So your stoma may fart and make some noises during sexual activity as your abdomen moves, contracts, and bends. You can ignore it or you can laugh about it. The contents will stay safely inside of the bag. So it's just another part of body function. Sex safety with an ostomy. So for the most part, safe sex is just like any other type of safe sex. So we're going to be using protection whenever necessary with new partners or to prevent STIs or pregnancy. And we're going to be communicating our needs and our boundaries before we are taking participation in any type of sexual act. One thing I always like to point out is that you should never, ever, 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 ever be putting anything inside of your stoma. Your stoma is just for your output to leave your body. Intestines are very fragile. They're sensitive. They can bleed and be damaged very easily. And yes, there actually have been cases where this has happened, and people have had extreme amounts of damage and infection from doing the wrong things with their stoma. And another thing is that there are stoma guards out there. There's a picture of that on the slide here. Let's see at the bottom. A stoma guard is a protective piece that attaches to the outside of your ostomy bag. So any type of ostomy bag it works with, they Velcro on, and it gives you kind of a like a protective cap. So if it gets bumped, it just hits that cap and it doesn't end up hitting the stoma behind. These types of caps can be good if you are in a relationship and you are kind of into rougher or kinkier sex acts. Some common questions that I get a lot, so we just put them here to answer. I am worried that my bag will leak while my partner and I are being intimate. What can I do to prevent this? So there are a few things you can do. They do make special bed covers and sheets that are easily washable or wipeable down that you can just put down underneath your body. And then there's also adhesive extenders that can be added around the adhesive flange of your ostomy bag attachment. And that can kind of give extra wide protection at the base that's adhesed onto your abdomen. So those two things are simple things that you can do. The next question, how can I be intimate without an anus or a rectum? So there are numerous ways that people can be intimate with one another that don't involve the genitals at all or the anal region at all. There are many pleasure zones around the body and over a dozen different types of orgasms that our body are capable of having that don't involve the pelvic region at all. Many people in the LGBTQIA community do practice anal sex just as heterosexual couples do. And while that option would be out if we don't have a rectum or we have a Barbie butt or a Ken butt, there are still ways that we can stimulate the area from external stimulation and other ways that we can reach orgasm and pleasure. Lots of information on that on our website. So all the information is there should you have that question. After my ostomy surgery, I lost the ability to achieve an erection. I miss being able to be intimate with my partner. What can I do? So it's super common at various times throughout life, especially with abdominal or pelvic surgeries, to lose some sexual function with erections. There are a multitude of different ways you can work on this, medication, surgical options, but there's also a lot of at-home therapies that can help restore that lost function and ensure that you can still have penetrative sex acts with your partner. Again, lots of information on this on the website, and in just a minute, you'll see some pictures of some of those devices that could help you out in that situation. Next question. Since my permanent ostomy surgery and placement, I have been experiencing severe vaginal dryness and discomfort with all intimate touch. I don't know who to talk to or what to do about this. Help. So first, people who you would talk to, your gynecologist, your oncologist, or even your like patient navigator or nurse navigator that's helping with your case. There are lots of things we can do to help with vaginal dryness or severe vaginal atrophy. Vaginal atrophy is just a severe form of dryness and the thinning of the vaginal tissues, which can create lots of problems for vagina owners. There are lots of different types of natural moisturizers that are out there that you can use multiple times a day. They are not prescription, so they don't have the added additives in it. They don't have chemicals. They don't have hormones. So if you're looking to avoid those types of things, they do exist. And these things can help you to really work on your body, bring back that moisture. And there are then devices that can help with insertion pain or kind of preparing to have that intimate sexual connection again as well. Sexual dysfunction overview. So sexual dysfunction for men and women can create a ton of problems, life problems, relationship problems, self-connection problems. Over 80% of humans will experience sexual dysfunction in their life. And there's more to that statistic. It's also from puberty to death in their lifetime. That's for men or women. And sexual dysfunction is defined as anything that hinders a person's ability to find sexual pleasure or orgasm. So some of the common causes of sexual dysfunction: cancer and illness, body changes due to surgery or intervention, natural aging, pregnancy, birth, and postpartum, menopause, life stress and chaos, mental health issues and neurological disorders, medication side effects, that's a big one, medical issues, genital diseases, heart disease, diabetes, obesity, chronic conditions, severe injuries, and sexual trauma and PTSD. And again, those are just some of the most common causes. So with sexual dysfunction, there are options for men. And what we do at Empowering Intimacy is, again, we kind of stand in the middle. So we have prescription options that your doctor can prescribe you, like the little blue pill. And you have surgical options that your doctor can help you with, like installing balloon pumps, things like that. We deal with everything that falls in the middle. So all of the things we can do with our own bodies to kind of restore that function. So much like if we injured our muscles, and we get sent to the physical therapist who tells us we need to go to the gym to work out these muscles. This is much like the gym for genitals, so to speak. So for men, erectile dysfunction is the most common thing we help men with when it comes to sexual dysfunction. Erectile dysfunction is the loss of ability to achieve or maintain an erection. There are different levels of erectile dysfunction. For some, it's an occasional issue. Others, it's kind of a temporary issue that occurs during a medical treatment or medications. And then for others, it is a permanent loss. And so it just kind of depends on your situation as to of course, what type of erectile dysfunction you might have. Um, Penis pump therapy is one of the top prescribed therapies for those who have erectile dysfunction. Penis pump therapy helps the male to restore lost function by helping the penis and the penile shaft um, reuse those cells, help those cells get back to work by pumping air pressure around and drawing blood into the penile shaft, creating an erection. This is done multiple times a week as part of a therapy. So when we're doing this as therapy, it's not really about the pleasure aspects of this, but for many men who do the therapy, they also report that they do feel some form of pleasure while they're doing it. But doing this therapy repeatedly can help those men who are able to get a semi erection, so one that is semi hard, but it's not quite firm enough to be used for sexual acts or penetrative sexual acts. These pumps can help kind of close that gap and allow a male to be able to have those penetrative sex acts with their partner. There's lots of different types of pumps out there. Across the bottom of the screen, you see different types. Starting on the side by the Empowering Intimacy logo, those are air pressure pumps. So those the user pumps with their hand to the desired pressure. And then they can remove the pump, leaving that black ring at the bottom around the base of the penis. It helps to hold all the blood in. That's how these pumps work. Next to those, you see two pumps that kind of look the same, but one is smaller, one is larger. It's a water pump. Water pumps are newer on the market. They can use warm water in them, or they can just be used with air. So you kind of get a dual feature. These pumps are extremely gentle for those who might have fragile genital tissues. If you've gone through cancer, cancer treatment, this happens very frequently. So that's another type of pump out there. And then the two on the other side here have different types of handles or no handles at all. And these are helpful for people who might not have the dexterity in their hands, or they might be facing a disability or handicap and not be able to use a regular pump. So there are tons of different types of pumps out there. We have tons of information on our website about them should you have questions. And a few more options for men who might be dealing with this. Wearable dysfunction devices. These can help to increase lost girth, increased size, and provide support for penetrative sexual acts. So these are more for those men who can achieve no erections at all or a semi-erection. These are, some of them are wearable devices. So if you see the center of the screen, there's a teal picture, and then next there's a white picture with like a black strap showing there. Those are wearable devices. So those slide on over a flaccid penis using lubrication. And then this allows the partner or the couple to have those penetrative connective sex acts with each other. So there are tons of different ways to still have that closeness, have that sexual connection with a partner, even if you've lost some of your natural normal ability. And then at the bottom here, it talks about masturbation devices, because again, for so many people, we are hesitant to jump back into being intimacy and sexually active with our partners or ourselves because we just don't know what our body's going to be doing. So if we can take the time to touch ourselves all over, not just in our genitals, to find the places that feel good, that don't feel good. We can use devices like these masturbation devices for men or women to help feel what things will feel like before we're taking that act with a partner. It can kind of help ease our minds and build our confidence so that we know what to expect from our bodies. That bottom row of pictures is just a variety of different types of male masturbators. Some of them are as simple as sliding it over the penile shaft and just using your hands with it. Others have batteries and preset options and offer sucking and pulling options, and it's just a personal decision on what you like or dislike when it comes to that type of stimulation. For women, lots of different types of sexual dysfunction that vagina owners can face. And one of the big ones with ostomy life is dehydration. So I've mentioned a few times during the presentation how important hydration is for ostomates, men and women alike. But it just hits women a little bit different because as our bodies dry out when we're not getting enough hydration, it also affects our vaginal tissues and can create some pretty severe dryness problems. So if you don't have vaginal atrophy, which I talked about a little bit ago, or that type of dryness, you can still have very painful dryness, whether it be externally or internally. And these creams that are across the screen here at the bottom, these are all different types of vulva balms. So these are thick, natural moisturizers. They can be used multiple times a day. There's no medications in them or chemicals in them. These are just Earth's wonders, so to speak. And some of these things have absolutely saved my life. So I can definitely give that testimony as well. Lots of information on our website about these. Should you have questions, I'm always happy to answer them. And then some more options for women. So a lot of times we hear from women that after they've had surgeries, abdominal, pelvic, genital, anywhere in the region, or had any type of cancer treatment, chemo, radiation, surgical intervention, that they often experience, along with that dryness, a lot of different types of tightness or cramping or pulling. So a lot of times women are prescribed dilator therapy or even Kegel exercise. So you have examples of different types of dilators here on the screen. You see the purple set of different sizes. When we do dilator therapy, we always use a lubrication. We start with the smallest dilator. Most often we work with a physical therapist that has a pelvic floor specialty. They can help with dilators, with knowing how to do the therapy, all of those things. And they often say you should start with something as big as your own pinky, and then you size up from there. Where you stop on sizes is what you're comfortable with. For some women, they will size up to be comfortable for gynecological exams when they insert the speculum. For other women, they will size up to kind of match their partner's size so that their body can be ready for those penetrative sex acts again. It's a personal decision. And then you also have wand therapy. So the three pictures in the center, the purple, yellow, and green, those are different types of wands. So wands are used for a little bit deeper kind of therapy and relief inside the vaginal canal. The yellow wand there is a temperature wand. So it can be heated up like a heating pad, or you can put it in ice bath and it can be cold like an ice pack. And if you're someone that experiences kind of deep uterine pain, or you have pain from adenomyosis or endometriosis or things like that, it's really wonderful to be able to put that hot or cold kind of immediately up there where that pain is. So that's something too that that physical therapist can help with. And then you see on the bottom here, the Kegel exercise. Kegel exercise is done by both men and women, but women have specialized devices to help them really learn how to do it. These devices are weighted, so that's kind of what makes them tricky. They are inserted into the vagina using lubrication one at a time and then held in place. Doing Kegel exercises is essentially squeezing and releasing the muscles that start and stop the flow of your urine. And with Kegel exercise, if you ask the internet if you're having these types of problems, the internet will just tell you, do some Kegel exercises. They will fix everything. And for some people, that is true. They will fix everything. But there are some women out there that doing Kegel exercises can actually make their issues worse. So that's why it's always good to kind of check in with the right people, your gynecologist or that pelvic floor physical therapist. And along with sexual dysfunction comes dryness. Men and women both experience genital dryness, so lubrication becomes a vital part of intimacy and sexual acts, especially after cancer, progressive illness, surgical interventions, etc. And again, another thing that affects our bodies, especially after ostomy surgery, is simply stress. Stress can also exacerbate all these issues and genital dryness as well. So knowing the differences of lubrication can be very helpful for your body and to kind of gauge what you need for whatever the situation is that you're going to be taking part in. So the two basic types of lubrications that are out there, you have water-based lubrication and silicone or silicone hybrid lubrication. So water-based lubrication is going to be like your KY jelly, your Astroglide, those things that have been around for a very long time, or Sliquid or System Joe. They provide a thin friction barrier and are very short lasting. So these types of lubrication, if you're using them, you're going to be using them a lot. You might even have to pause in between your sex acts to apply more just to keep your body safe. Our bodies are made of water, so we absorb water from everything, which is why these lubes just don't last as long. So if you are looking for a thicker friction barrier, you'd want to side with the silicone or silicone hybrid lubrications. Those are typically best for those people, cancer patients, those with progressive long-term illness, and those who have hydration issues, to really keep their genital tissue safe from tiny little wounds from penetration or friction that might occur. These types of silicone lubrications aren't absorbed by our bodies as frequently because we don't need silicone like we need water. The good news is with lubrications is that many major grocery store chains and retailers have lubrications kind of in the condom or the tampon aisle. So if you needed something like this, they are easy to get. And plus, places like Amazon, Walmart.com, Target.com, all your major online retailers as well. And we have all of this information linked on our website so you can see like the cheapest places to get these types of things. We at Empowering Intimacy do not sell any products or anything like that. We just teach on them, and then we like to tell people what we think are top quality as well.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org. Or follow us on Facebook. We'll be sharing additional information on upcoming programs.